Very good afternoon, everyone. I am Dr. Amol Narkede, consultant orthopedic surgeon working at Victor Hospital, Margao, Goa. My area of specialty is orthopedic trauma, arthroplasty, and knee arthroscopy. Under trauma, we offer treatment of all fractures and dislocation of upper and lower limb and treatment of that. Under arthroplasty, we treat all kinds of arthritis and including the treatment like hip replacement, knee replacement, shoulder replacement. In arthroscopy, we treat injuries of ligaments of the knee like ACL ligament, PCL ligament, MCL ligament, LCL ligament, cartilage lesions of the knee, and recurrent dislocation of the knee. Today's topic of discussion is osteoarthritis of the knee. So, osteoarthritis of the knees is nothing but an age-related degenerative condition of joints of the body. It most commonly involves the knee joint. Now, let us see what is a normal joint and arthritic joint to get a better understanding of this. So, this diagram is showing the healthy knee joint and arthritic knee joint. Normally, the knee joint consists of lower end of the thigh bone, that is femur, and upper end of the leg bone, that is tibia. It is covered with hard white coating that is called as articular cartilage. It has the protective function. Between these bones, there are cushions. They are called as menisci. They are they act like shock absorbers. So what happens in arthritis is after the age of 40 to 45, just like graying of the hair, this cartilage starts degenerating. It starts getting rubbed off. Similarly, these cushions. So there is a loss of cartilage, there is damage to the cartilage, the thickening of the menisci decreases. Consequently, the gap between the joint decreases. This is called as osteoarthritis. Osteoarthritis is common after 40 to 45 years of age. It is divided into four stages, that is early, mild, moderate, and severe. In early stage of osteoarthritis, patient usually gets pain on excessive walking, excessive climbing stairs, running, jumping, dancing, or any kind of exertional activities, which is relieved by rest. But these patients can be easily treated by doing some lifestyle modification and physiotherapy exercises. Then the second stage is mild stage. In this stage, the patient usually gets a dull aching pain, usually at the end of the day, and this pain is aggravated by specific activities like sitting on ground, sitting cross-legged, squatting, kneeling, using Indian toilet, getting up from the chair, getting up from ground, and these patients will need some medicines and physiotherapy. Then the third stage is moderate stage. So in this stage, the pain increases in severity. The walking distance is considerably decreased. If someone is going for a morning walk and walking for a distance of around 2-3 kilometers, then that distance may reduce up to half kilometer to 1 kilometer. And this pain is usually disturbing your daily routine activities, professional life, and social life. And the last stage, which is severe, that includes excruciating pain in the knee. The knee may develop some deformities, and it is extremely difficult for the patient to walk. These patients are usually homebound, and it is difficult for them to walk even outside the house. And they need some kind of aids like walker or stick during walking, and this is the stage when most of the patient need the knee replacement surgeries. So this is overall the presentation of the osteoarthritis. Now coming to the treatment of osteoarthritis, let me tell you Only 75 to 80% of the patients presenting with osteoarthritis, they just need some kind of physiotherapy, lifestyle modification, and few medicines. 10 to 15% of the patient which don't get benefit by this may need some kind of injections. Those are called as intra-articular injections, and only remaining 4 to 5% of the patients who are extremely disabled that they cannot walk also outside the house, they are the candidates for knee replacement surgery. Now let's see what treatment, how is the treatment. First and foremost thing is lifestyle modification. Now, lifestyle modification includes like avoiding certain activities like sitting on ground, sitting cross-legged, squatting, Indian toilet, and avoid activities which are going to put pressure on knees like running, jumping, sports, dancing. Then the question comes to the mind, then so many activities are restricted, then what is one supposed to do? The things which are recommended and very good for the knees in osteoarthritis is walking up to a distance of 2-3 kilometers or less as per the pain tolerance. Cycling and swimming is considered extremely good in osteoarthritis of the knee. Even walking in water is good. There are some specific physiotherapy exercises which can be easily learned from the physiotherapist and they can be practiced at home. Then comes the role of the medicines. The medicines are in the form of analgesic, anti-inflammatory medications, anti-arthritic medications, and if it is for other kinds of arthritis like rheumatoid, psoriatic arthritis, there is different kind of treatment. Then those people who are not getting relief with lifestyle modifications, physiotherapy and medicines, then we can offer them treatment in the form of intra-articular injection. Now these intra-articular injections, they are of two types. One is the steroids and other is hyaluronic acid. The normal knee joint includes around 3 to 5 ml of synovial fluid. So that is the lubricant, and that lubricant also decreases as the stage of osteoarthritis increases. So by giving this injection, we are providing lubrication to the joint and reducing the inflammation that is swelling within the joint to give the pain relief. Now the steroid injection will give you relief for about 4 to 6 months, and the hyaluronic acid injections, they will give you relief for about 1 year. Both of these injections can be repeated couple of times in a year. Now remaining patients, that is 3 to 5% patients who are not getting better with any kind of treatment, those are the candidates for knee replacement surgeries. So let us first see what we actually do in the knee replacement. So this is a arthritic knee. So here you can see this is the lower end of thigh bone. This cartilage is destroyed completely. The meniscus are also destroyed. So what we do in knee replacement is this damaged part of the cartilage, it is replaced with a metallic implant on upper side and lower side, and these cushions which are also destroyed, they are replaced with the plastic cushion. Similarly, the under surface of the kneecap is also replaced with a plastic surface. So this is called as total knee replacement. This total knee replacement gives you long lasting relief for around 15 to 20 years after the surgery. Only precautions which are to be taken are to avoid sitting on ground, sitting cross-legged and Indian toilet. One can very well sit on stool, chair, bed, sofa. There is no restriction on walking or climbing stairs. The surgery usually takes around 1 hour. The surgery is almost 98 to 99% successful. The patient has to be admitted for around 3 to 4 days in case we are doing surgery for one knee. and for about 7 to 8 days in case of surgeries for both knees. Thereafter, the patient can be discharged. Usually, the stitches are removed after 2 weeks from the surgery. The patient during this time, around 1 month after the surgery, the patients need supervised physiotherapy for a period of 1 month, and the patient also needs some kind of support for walking in the form of walker and stick for a period of 1 month. After that, the patient can walk independently without any support. Patient will need some kind of medications for pain relief for about two months after the surgery. After that, the patient hardly needs any kind of medications. Now let us come to the questions. So there is first question from Trupti Malshi, that is how long will the recovery take after the knee replacement? The recovery after knee replacement usually takes around 1 month, and for 1 month, as I said, patient needs supervised physiotherapy, needs walker or stick for walking. After that, the patient can walk independently, and after 2 months, the patient can go up, free to go outside home also, can ride a four-wheeler or two-wheeler also. Second question is from Anisha Mandoka. So very good questions. Are there any natural remedies that can help in relief of knee pain? Yes, of course. In early stage of arthritis, that is stage 1, stage 2, or even early stage 3, there are certain modalities like weight reduction and avoidance of activities which are putting stress on the knees, like sitting on ground, sitting cross-legged, Indian toilet, running, jumping sports. These activities should be avoided. Walking up to 2-3 kilometers, cycling, swimming, walking in water, weight reduction. These activities are helpful in reducing the pain in osteoarthritis in early stages of arthritis. Next question is from Mr. Lakshman, and he wants to know if there are any foods that can cause arthritis. Per se, osteoarthritis is not caused by any kind of specific foods. It is a age-related degenerative condition that happens to everyone. Some people it will happen earlier, others it will happen later. That depends on multiple factors. There is body weight, heredity, lifestyle, how much is the stress on the knees. So, in simple words, osteoarthritis, lesser the weight, better it is. So we should concentrate on food that is healthy and that will not lead to excessive weight gain. It is better to avoid spicy and oily food. But there are some kind of arthritis other than osteoarthritis, like rheumatoid arthritis, gout. So these kind of arthritis may get precipitated by having sour food, alcohol, non-veg, spinach, tomato, specifically in gouty arthritis. But in osteoarthritis, it is as simple as keeping the body weight to minimum in the healthy range. The next question is from Miss Seema. Can I do anything to prevent arthritis? The arthritis cannot be prevented as such. As I told, it is an age related condition. But to delay its progression, again we have to have healthy food so that there is not weight gain. If you have excess weight, then you need to reduce the weight, do regular exercises. There are specific physiotherapy exercises, swimming, cycling, which can be done to delay the arthritis. Next question is from Mr. Simon. What are the lifestyle changes I have to make to help in relieve pain? Lifestyle changes will mainly include weight reduction and the activities which are going to put stress on the knees, like sitting on ground, squatting, kneeling, Indian toilet, dancing, running, jumping. All these activities should be avoided. And knee physiotherapy, swimming, cycling, and walking up to 2-3 kilometers is advisable in osteoarthritis of the knee. Another question is from Mr. Vinayak. He wants to know what are the symptoms I should look for in case of osteoarthritis. Now there is variety of symptoms which may be from very mild pain after exertional activities, which is usually seen in very early stage of arthritis, which may progress to a dull aching pain at the end of the day in the mild stage of arthritis. When it goes to moderate stage, the pain is more or less constant. It is usually aggravated by sitting on ground, sitting cross-legged, excessive walking, climbing stairs, or any kind of exertional activities like running, jumping, and sports. So these activities should be avoided. And in case of advanced arthritis, there is severe pain and it is very difficult for the patient to walk even within the house. Next question is from Ms. Rakhi. What will happen if delay in surgery for another 8 to 12 months? See, knee replacement surgery is not an emergency surgery like fractures or dislocation. Fractures and dislocations are the kind of problems which need immediate attention, maybe surgeries in severe cases. But osteoarthritis, it is totally decision of the patient. So the patient, it depends on the patient's pain tolerance. If the patient can tolerate it for a period of 1 month, 2 months, 6 months, then that is possible. But a small advice here, if the pain is extremely disabling, that it is affecting your daily routine, your professional and social commitments, then it is better idea to get it done as early as possible. A delay of a month or two will not cause any harm, but a delay of maybe 6 months to 1 year may result in more damage to the knee joint. The surgery may become little difficult per se, but it is very much possible. There will not be any problem for the patient, but technically surgery may become little difficult. But that is not something which is scary. It can be easily taken care of. So in the end, I will just like to end this talk with a small message. Just stay home, stay safe, take very good care of yourself, and thank you for a patient hearing.